Hi, hello. I'm Justin Riel with the Arizona State University, and I'm pre-veterinary medicine student, and I'm here to talk about the uh, leishmaniasis, an emerging disease in the United States. Uh, so, what is leishmaniasis? Well, it's a parasitic disease caused by the Leishmania species. They are vector-borne, so they're transferred through or transmitted through mosquitoes or sandflies. They're zoonotic, which means a lot of mammals can contract this or be infected with this parasite. Humans, dogs, cats, um, bats, you name it. They are endemic to the tropical and subtropical regions of the globe. You don't see it too much in the United States, but this is why we're talking about this today. And contracting this disease can be fatal because the treatment and vaccines not available. And here we see a list of some of the within the animal kingdom that we have found these parasites as using their host as reservoirs in coyotes, foxes, bats, armadillos, possums, rabbits, sloths, humans, and hamsters. And here we can see the life cycle of the Leishmania parasite. It goes into the bloodstream, neutrophils attack it, and macrophages will attack the neutrophils that have already consumed these promastigotes. And within the macrophage, the promastigote starts to differentiate into a mastigote, then multiply itself, and then it eventually kills the macrophage and bursts back into the bloodstream, where it will infect new cells and other organs. And then another sandfly will come in and take another meal or take a blood draw from the infected host. And another cycle begins within the sandfly, where differentiations go from amastigote to promastigote. And here we can see the plot demonstration of when the healthy sandfly takes a bite from an infected host. So it ingests these mastigotes that have been floating around in the bloodstream. And once these mastigotes are consumed within the sandfly, they go through differentiation, become promastigotes. Here, where they will have a tail, and then they'll wait patiently until the sandfly goes and infects or takes a bite out of a healthy animal or healthy host. And here we have a healthy dog, where the sandfly takes a bite and injects these willing promastigotes into the bloodstream, where it will be attacked by neutrophils and macrophages to consume them, which is a part of our immune system. And then, the macrophage, thinking that they are the hero, that they've killed the parasites, and eventually it does. In some mammals, it can kill these parasites, but for the most part, it doesn't. And it just multiplies within the macrophage, goes through differentiation first into a mastigote, and just burst out into the bloodstream, where they will just infect new cells. And then a sandfly will come back, bites the infected host, and that's the cycle just keeps going round in circles. And so, when we look about it in North America, we have to think about climate change, globalization, the symptoms of the disease or signs of it, how to prevent the disease, what vaccines are available for us. We don't have any vaccines here in the United States, and they are available in Brazil, and 2 of them are available in the European Union. However, we do have to request a permit from the CDC to be able to introduce these vaccines into the country. Rapid PCR tests would be preferred to screen, especially since we are a non-endemic region. If the patient is positive, then a serological quantitative testing would be preferred to see the titers, to see the numbers. so that we can see that what kind of antibody or how many antibodies are within the blood of the patient. Using glucocorticoids are not recommended as this affects the immune response. Again, some dogs and cats can fight off this infection with just their immune system. So use of glucocorticoids could affect that if the dog is, or the host would be able to do it alone. Allopurinol would be needed to treat the symptoms if an animal is infected with it. Again, there's no vaccine for humans. So if our pets get it, we are also susceptible to receiving this infection through a vector such as the sandfly.